Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Today we'll talk about study identifies blood biomarkers to forecast cardiovascular disease risk in rheumatoid arthritis patients. A recent study in the Journal of the American Heart Association, led by a physician at Mass General Brigham, identified 6 blood biomarkers linked to cardiovascular risk in rheumatoid arthritis patients, which helped in improving predictions of future arterial inflammation. Rheumatoid arthritis impacts approximately 17.6 million people globally and is associated with an increased risk of cardiovascular disease. Assessing cardiovascular risk is difficult in patients with rheumatoid arthritis because standard clinical assessments based on factors like age, cholesterol, and smoking status tend to underestimate cardiovascular risk in individuals with rheumatoid arthritis. We think these biomarkers might improve our ability to predict risk and intervene early to help our patients, said first author Daniel H. Solomon, MD, MPH, Chief of the Section of Clinical Sciences in the Division of Rheumatology. The idea is that if we measure biomarkers that are specific to rheumatoid arthritis, we might be able to better identify those at highest risk of cardiovascular events.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
To identify rheumatoid arthritis specific biomarkers of cardiovascular risk, the researchers assembled a panel of 24 candidates biomarkers that have been previously shown to be associated with rheumatoid arthritis and systemic inflammation, and measured the concentration of these biomarkers in 109 patients with rheumatoid arthritis who were taking part in randomized clinical trial, that is the target trial, to compare the efficacy of 2 different treatments for rheumatoid arthritis at preventing cardiovascular disease. They measured the biomarkers at the beginning of the study and 6 months later, imaging the patient's arteries at each time to assess their arterial inflammation, an indicator of cardiovascular risk. The findings of the study revealed that 6 of the 24 biomarkers were associated with increased cardiovascular risk and could be used in predictive models to improve the researchers' ability to predict increases in arterial inflammation compared to standard clinical indices, which are based on the factors such as age, sex, cholesterol, blood pressure, diabetes, and smoking. Arterial inflammation can predict future cardiovascular disease risk, said cardiologist and co-author Ahmed Tawakkol, MD, the Director of Nuclear Cardiology and co-director of the Cardiovascular Imaging Research Center at Massachusetts General Hospital. If you take a snapshot of a person's blood vessel, the more inflammation that is measured there, the greater the likelihood of person will have the progression of the disease and the greater likelihood that they would have a stroke or a myocardial infarction. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.